Good afternoon, welcome back. This is Saima. If you haven't met me before, I'm a nurse from Southeast England. In today's video, I'm going to talk about nursing professionals, or for the people who are not yet nurse, they haven't gotten their degree or they haven't gotten the desired qualification that they need. They are still in their studies and they are not sure what they are going to do. So this is all we are going to talk about, because this type of questions I'm getting a lot on the comment section. In the comments, a lot of people ask me how they can start their career in the UK and they are still completing their studies. So in terms of your planning and your studies, after you pass your graduation, you need to know, you need to make a plan what you want to do in your life, isn't it? So if you want to become a nurse, or if you want to join any other specialty, you need to decide what is your aim, what is your plan. Are you able to do it? Is your qualification enough for you to have that kind of job that you want, or that kind of course that you want to do? For example, if you want to do nursing, you need to know, are you eligible to apply for nursing, isn't it? And also, if you want to, if is there any other specialty that you want? Even if you are a nurse, you want to become a cardiac nurse, or you want to become respiratory nurse or ICU nurse, what kind of nursing do you want to do? So it starts from very beginning. Okay, if you are not sure about your plans, make a plan. Try basic general nursing you still need to do. You need to complete your nursing, and after that you can do specialization courses. You can do cardiac ICU nurse, or you can do cardiology, ED, you can do diabetic or endocrinology, whatever whatever area interests you the most, you can do that. And here I would suggest, like, when you come to the UK, the specialties, different wards, different areas, they all are different, so everything seems very different when you come here. But when I was hired for a surgical department because I was an ICU nurse. But when I come in here, they hired me for surgical nurse, but when I came in, they put me in the medical ward. So it depends on your organization where they need you the most. But if you have experience in ED, like for example 6 to 7 years, obviously you will go for ED department. So you need to reiterate to them when you arrive here in the UK. You can still tell them that I'm hired for ICU nurse, or I am hired for ED department, so they will put you in that department. So for me particularly, they didn't ask me where I wanted to go, but considering my experience, I was cardiac ICU nurse, and I also worked as OPD nurse for some time, and also in the cancer theater nurse also for 1 year. So maybe considering my experience, they hired me for surgical, but there was no vacancy, or I don't know, when I arrived here they put me in medicine, and I quite like it. I'm quite happy with it, no issues. But if you are someone who is really peculiar about their interest, like if you want to work in surgical and you want to be in surgical, then yes, tell your educators, when you are here in the UK, tell the people you are dealing with, your HR department or your nursing for workforce lead, tell them that you want to go in your area only, you can't work anywhere else. But agencies that are hiring you, they will also tell you that where the vacancy is. And also when you apply for the vacancies it will also show which ward they are going to put you in. So don't worry about it. My case was totally different, because when I was hired, it was in April 2020, and then COVID hit. COVID time came, so I couldn't come here in the UK. So I was in my country after getting my visa for almost 1 year, so I didn't come through because of the COVID. So maybe that's why when I came, the initial vacancy that I was appointed for was gone or something, I don't know. So anyways, so you need to mention it to your educators, your nursing workforce, when you are still preparing for your OSCE, that this is your most interested ward, or this is your favorite ward to work in. or this is the area you would like to work in. Yes, so all I want to tell you about is, if you want to become a mental health nurse, someone asked me a few days ago that they want to become a mental health nurse, how do they start the procedure? So there is a different kind of training that you need for mental health nurses. So go for the training. If you want to become a diabetic nurse, go get the diploma, get the degree for the diabetic nurse, and then you can join here as a diabetic nurse, or join here as a mental health RN. For the people, for the people who wants to become mental health RNs, to be honest, it's really good. The salary of mental health nurses here are really good, but let me also remind you, the patients that you're gonna get, they are very challenging. They can be very challenging, they can be harmful, they can be very serious as well. So if you get the training, you would know how it is. But if you get the proper training for mental health nurses, there will be no problems for you, no problem at all for mental health nurses. But the salary is really good, and I would like to do mental health nurse as well one day, if I can, if I get the time. But I think that's a bit like you need to be very strong and assertive in what you do if you want to become a mental health nurse. So I think I'm a bit polite kind of person, so I'm not sure. I still have time to think about it, and I'm not thinking about it at the moment. But yes, so for the people who want to become mental health RNs, the salary is really good. They can, most of the times you will get jobs in the agencies, in the nursing care homes, and in the NHS if they have mental health patients. And also for the people who wants to study further here in the UK after they are here, there are different kinds of posts always coming up. You can do bachelor's, while if you haven't done, if you are a diploma nurse, you want to do a BSc top-up degree, you can do that here as well, and NHS will pay for you MSc as well. But it depends on the organization, if your organization has enough budget, or if they have enough money to support you. There are different courses that you do. Me as a nurse, I've done so many ESR trainings, competencies, so NHS pays for them. If you go anywhere in any other university to do any course, NHS pay for it, so it's really good. And also if you're going somewhere else to attend a webinar or to attend a seminar to get a training, NHS pays for your course only, your educational cost only. NHS will cover, but the accommodation and the transport, you will be the one to sort it out. So it's really good that they give you the sources to promote yourself. They give you the sources to develop yourself, to get more learning, and to get some knowledgeable information for your career according to your department. For example, if I'm a medical nurse, if a medicine nurse, I'll be more interested in courses like dementia or Parkinson's, Alzheimer's, things like that, or dolls, safeguarding. So it depends on your area. Okay, so if you want to do further courses in your department, and a lot of other people, they want to do courses as well, so they'll tell you that if they have enough budget, or two people from the same department, can they grant the permission for both of them to attend that course. So you need to speak to your manager, you need to speak to your band 6s if they allow, and if they have enough budget, you will go for that course. So let me just guide you a little bit in terms of getting the courses. It is really helpful for you if you want to study further, if you want to do different kind of skills, if you want to attain different kind of skills, different kind of courses, to get yourself more knowledgeable, to enhance your knowledge in terms of your ward, in terms of your patient, related to your ward. So I would suggest do as many courses as you can, because it will be good for you. And on and off, they have like CQC visits, or any visits from the matrons. They come around, they ask you questions. Oh, do you know what is it? Do you know how to handle it? So your seniors shouldn't be there all the time to tell you what is it, or they will be there, but if someone asks you, you should be able to answer the questions. And if you can only answer if you know it, isn't it? So go for the courses. I would suggest, if your manager allows you, or if your roster allow you, you can always go for the courses. And there are loads of free resources available on the intranet of the hospital, so you don't need to pay, or hospital don't need to pay for it. But there are some paid courses, some paid CPD as well, continued professional development, and some are free. So if you are here in the UK, you're a nurse, I would suggest you study as much as you can, improve your knowledge, develop your skills, and your personal development is very, very important. And if you are on a senior post, always get upset or go mad on the seniors, not on the juniors, because juniors can't do anything. But if you are upset with your seniors about anything, for example staffing, they're not giving you enough staffing, so if you moan on the seniors, they can do something about it. But there's no point. I mean, they need to, juniors also, they need to know that this is happening, but they won't be able to help you as much as the seniors can. So if you're worried about something, if you're upset about something, always moan on your seniors, not on your juniors. This is the thing I learned recently, and I'm glad that someone told me about it. And yeah, it is really good to learn some things. Always listen to your seniors. Always, if someone is talking to you, listen to them attentively. And because we come from a different culture, our language is different, our behavior is different as well in terms of eye contact. So always pay attention. If you're talking to someone, pay attention what they're saying and answer it in an appropriate way. And yeah, this is all. We started the topic of doing nursing, or going in your favorite profession, or in your specialty. Yeah, so planning is the key. Planning is the key. If you want to become a cardiac ICU nurse, work towards it. Do your nursing, do a specialization in cardiac. If you come here, and you can still do loads of different courses. If you are new here in the NHS, you cannot decide which ward you are going to, where you want to go, what you want to do. Work for at least 6 months where you are assigned to. Look around, book loads of bank shift, go around, work in other departments, and see which area you like the most. And then if you feel like, oh, this is a place I would like to work in, so go for that work, that job. If you are someone, if you are here in the UK and you are someone who is interested in working a totally different specialty, for example research nurses, or diabetic nurses. So diabetic nurses job is really good here. They come and they visit the patient, they check their insulin levels, they prescribe their insulin levels, they check their medications, they check their diabetic diet and everything. So it's really good. They come only to see your patient. So I like the job of diabetic nurses. It's really good. You can also be a tissue viability nurse. You can also be what do you call it, diagnostic nurse. You can be a research nurse. You can be a alcohol specialist nurse. So there are different specialities that you can do. Yeah, you can also be a liver gastro nurse. You can be any kind of nurses here. You can, if you are nurse already in the UK for a couple of years, you can also apply for advanced healthcare practitioner, and you can start prescribing the medication. You do the assessment, you check the patients, you also prescribe the medication. So you can become advanced healthcare practitioner. You can ACP we call it here. Also in the ICUs, in ED, they have people who do the assessment only for the doctors. So there are different kinds of jobs available here when you are here. So sorry, so in order to come here, that's the main point, to make your base. That is the very, very important thing that you need to work on. Yeah, so base is very important. If you are a nurse, then only you can do these things. You need to do your nursing. When you are back in your country, you need to focus on your English test. You need to do your nursing. You need to look for the specialty you want to work in. So make a plan. Planning in the life is very, very important. Make a plan what you want to do and how you want to pursue your career. Yeah, so I hope you enjoyed this video and it was helpful in some ways. If you found this video helpful, please let me know in the comment section. I'll see you soon in the next video. Till then, take care. Bye bye. God bless you.